Even 7, 8 years ago, we were not that advanced to give pills to patients. Patients had to come into the office, sit in the office for hours at a time, spend most of their days here. But now it's amazing that with targeted therapies, monoclonal antibodies, how things have changed where patients can take the pills at home, and the quality of life is definitely much better. You wouldn't be where you are now if it were not for the clinical research that has taken place. The way I talk to patients is that most of them usually go on clinical trials after they've been treated with standard therapies, and that is another option that is always available for patients. And yes, talking to them sometimes can be challenging, but when you do explain to them the rationale and the benefits, most of them do agree to participate in clinical trials.
So I have a diagnosis of ITP. It is an autoimmune disease with an unknown cause. So blood disorder with an unknown cause. I found out about it 2 years ago. So me being 32, I was 30. It was actually on my 30th birthday, worst news ever. No one in my family has ever had it. They don't have a clue. The medication that you take to, I wouldn't even say cure it, but treat it, is similar to, actually not even similar, it's exactly the same to someone that has like lupus or leukemia that would also be treated here. Most of the time when I come into the office, Dr. Akula will start conversations, just general conversation. How is work? How is home? I think to see where your conscious lies just coming in, because my diagnosis is stressful at times, being unknown. Dr. Akula wants to be sure that you're feeling comfortable in your personal life, and then you discuss your options for treatment. She was very open. She told me she would be very honest with me from day one. It's a loving sense about her that I don't know, it's that feeling. You kind of get that loving feeling when you're with her. So coming to the office is great. I would do whatever she tells me because it's a sense of comfort that I'm doing the best that I can. I'm making the best decisions for you. The patient-doctor relationship probably is the most important thing in medicine. You develop a bond with the patient, their family, especially in the field of oncology. And that means a lot both to the patients as well as to us too. I mean, it helps us understand what they're going through, help us support them better when we do develop a relationship, a close bond with the patients.